Jeanette or Kristen or Monica, who would like to
Yeah, it's
handle your part of the presentation?
That's going to lead this.
So unlike Giuseppe and Unity, we actually did not go directly onto Verto. So our challenges were related to, we were using a Power BI app to begin. It did not offer a self-scheduling option. So we were doing all of our bookings through a call center. And we had initially staffed that with 6 users in our call center to take all the phone calls. And very soon after opening, we realized that 6 was not nearly enough, and we were inundated with calls on our phone lines. So we were very often having 20 staff manning the phone lines. We were grabbing staff from wherever we could to help us with our call center. And our wait times could be quite lengthy, up to 45 minutes really. On some days, just with the number of calls that were coming in. So we determined that this was just not going to be manageable, considering that we were still only dealing with, a select population of long-term care homes that were trying to gain these appointments. So that was quite challenging for us. And due to this, we were having a large number of bookings that were happening same day or next day, because with the number of users we had booking these calls, we just couldn't get ahead. So ideally, you want your next few days booked, and we were having to do all these kind of almost real-time bookings to get people in to fill the number of slots. So not ideal situation there. When we did have our patients booked in, we had a bit of a fragmented view. Particularly, it wasn't much of an issue when we first started, but once we started getting into second doses 21 days later, we couldn't actually see all of our first doses and second doses in one view. So it was really difficult for our staff with the workflows to see who was coming in because they were having to kind of toggle between screens. We did have dashboards that were very, very useful, but we had to have 2 dashboards up because we saw our first doses separate from our second doses. So again, it was a bit fragmented. The other issue that we're having within our call center is that when patients were calling to reschedule their appointments, you could only search for the patient if you were on the correct day. So there was no way to search our entire scheduling database to find the patient. So hopefully they knew what day they were scheduled for so that you could easily rebook them or cancel them and reschedule them. But it did lead to some challenges with trying to find our patients. So those were the challenges that we were having with our previous booking system. So if we can go to the next slide.
Sure, just before we do that, Jeanette, and I don't want to dig up old pain, but can you just tell the story briefly about the 3,500 patients you guys had to schedule based on ethical prioritization?
Well, I was going to get to our rescheduling process on our next slide, but
okay, I'm happy to advance if you've already got that in your
So I was including that as part of our solution that came with our rescheduling of our patients. So as many of you had, we did have a bit of a pause. So our previous solution was doing a 21-day automatic book, and we now had to pause all of our second doses. And during that pause, that's actually when we did reach out to Verto, and that's when we were doing our change over to our new solution, is when we were on our close time due to vaccine availability. So Verto, we did go live with Verto in about 10 days. As I mentioned, we were closed at the time. We went live with Verto when we were opening on a Friday, when we were opening up on the Monday. So we started that process, but we did have, actually we had over 7,000 patients that we needed to reschedule due to our pause. And this is where Verto's ability to do a mass upload really benefited us. We started out having to, call everyone back and get new appointment times. And not only did Verto do the mass backload for us, but they actually created the appointment times for us. So we just told them what days we needed people scheduled in for. They generated the appointment time. They backloaded all of the information. So we did have an upload from we did have a report from our previous scheduling system, and they took that in over a matter of days. They backloaded, uploaded 7,000 appointments into our system for us from our previous solution. So that was, if you could think of what the manpower would have been to have our staff actually entering 7,000 appointments into a system, it just, the time saving was phenomenal there. And the other benefit to that was at the time of those backloads, the clients got the automatic confirmation message as well. So, the other concern was after the close, how are we communicating out to people when their new appointment was? So that confirmation message that, again, same as Giuseppe had mentioned, is the information regarding consent, where to go. We have a virtual waiting room that we use that people sign into when they arrive at our vaccination clinic. So we had the link to how they can register to our waiting room, and all of that information going out, not only at confirmation of their appointment, but 48 hours again prior to their appointment. Hugely beneficial for us when we're trying to contact 7,000 people about their new appointments. And also, we're just started really our self-scheduling option. So that was just before the weekend, we opened up the self-scheduling option to our long-term care areas. So right now we are currently sitting with only 4 people on the phone, down from the 20 people that we were having before. So we were able to decrease our numbers there. The other benefit is that we're seeing all of our patients in one view. So we're seeing first doses, second doses, all in one view. There's an icon that easily identifies which ones are second doses. And we do have a customized dashboard that we are having updates to starting tomorrow, which we're very excited about. But that dashboard has become integral to our workflow within our vaccination center to be able to see how people are moving through. So really help to support that workflow for our users at the vaccination clinic.